In 1893, the superintendents of nursing training schools met at the Chicago World's Fair to set standards for education. This was in response to a proliferation of unsupervised training programs. Isabel Hampton Robb, superintendent of the nursing school at Johns Hopkins Hospital, organized the group, the American Society of Superintendents of Training Schools, which later became the National League of Nursing Education, and today's National League for Nursing.
Very nice and quite gracious for you to have us in your home today. I'm wondering if you would start out, if you will, by giving us your definition of nursing.
Well, I'll see if I can remember it. I had to enunciate this, you see, when I wrote a textbook. When you teach and when you write, you have to commit yourself. I don't know that I ever would have bothered to do this if I hadn't been forced to. But I began thinking, what do I do for people? And I decided that I try, if I go into a room with a sick person, or even if I see my friends, I think I try to get inside of their skin, put myself in their position. And then as a nurse, I try to do for them what they would do for themselves if they had the strength, the will, and the knowledge that a nurse has. And I try to do it in such a way that I don't make them dependent on me any more than is necessary, so that I can give back that activity, whatever I'm doing. I try to make myself, I don't try to make myself indispensable. I try to make myself dispensable at the earliest possible time. Do for others what they do for themselves. They have the strength, the will, and the knowledge. But to make them independent of help at the earliest possible time. But now that's not all I say, and that's what troubles me about the way people quote my definition. They stop there. And I go on to say, and I say this much more emphatically every time I say it, because I think this is what nurses have got to realize and what the public has got to realize, that the nurse also diagnoses and treats. If she is the person available to that person who needs that help, if there's no doctor available, she invades this holy of holies, the practice of medicine, which I think is foolish for them to think they practice alone. They don't. We all practice it for ourselves every day. We diagnose ourselves. We see, is this something I ought to take to the doctor, or can I handle this? Every nurse, every good midwife, of course, that's her field. She helps the patient, delivers it if she's able to do it. Now, I think we also do that in every other field. We've been doing it in public health all these years. We just don't come out and say it. And I think now we've got to begin to say it, because the World Health Organization is saying we are the people, because of our numbers and because we have the next best preparation for it to the doctor, we've got to give primary care and acknowledge it and prepare people for it. And primary care involves diagnosis and treatment. When I started, we had no index to our literature. The nearest thing we could come to finding out what had been studied and written and reported in our literature was to use the Index Medicus. The Index Medicus indexed the content of 4 nursing journals. Just 4. And it took me until late in the 50s and 60s to get nurses interested in constructing an index to our literature. We had to wait all that time. And I went to the people at the National Library of Medicine, and they said, Miss Henderson, you nurses go ring your own doorbells, get the money, then we'll do it. You can't expect us to divert our funds to that. That's your job. But I could not get nurses interested because we were doers, we were not scholars. It's simple. We had so much to do for people, we hardly had time to think. I came from a family of scholars. I was not considered a scholar because I really like to do things more than to read about them or talk about them.
Dr. Elizabeth Carnegie is a leading historian of the African American nursing experience. She remembers Eunice Rivers' work and the choices that work involved.
Eunice Rivers was at Tuskegee when I arrived. I went there in March 1938, and she was there then, had been there a number of years, and was working as a public health nurse manure. In those days, and that's not true today, but in those days, the doctor was God. Whatever he said went, and you did not question. Yours is not to question why, yours is to do or die. So the nurse did not question the orders from the physician.
One approach to answering the complex questions posed by Eunice Rivers and similar questions in today's nursing practice is critical thinking. Dr. Christine Tanner, leading nurse educator, explains the theory behind critical thinking.
Well, I don't think humans in the world are ever purely rational. I think that it's a mistake to assume that we can be totally rational. I think that we stand within always our cultural understanding, our background meanings, and that when we try to step out of those, that we really lose some of the important meanings in our lives. So I don't think it's ever purely rational. I think it comes from a position of involvement and caring. I think Nurse Rivers had the perspective of community in its fullest sense, and public health for the good of the whole, for the masses. In recent years, as we've moved away from community-based practice models to what's good for the individual, I think we've lost sight of these bigger perspectives. Many professionals have tried to remind us of the relationship between poverty and health, for example, but the voices have not been heard. We've continued to view health as a commodity, something that we could buy.
So nice to see you again, those past years at TC.
It's wonderful to see you, and it's been wonderful knowing that we were going to get together, remembering some of our shared history.
What about the financial support for the programs?
We said that any college that was in our project, and I think this holds true today, must be willing and able to finance this program as they finance every other program. And so the student paid the same tuition as comparable programs in that college. And they financed themselves. Obviously, colleges had student loans and student scholarships and so on, but they were treated just as any other college student was. And that's the first time in history of nursing education that the financing did not fall upon the hospital patient. The hospital patient has financed nursing education through all these years, and still does to some extent in those hospital schools that still exist. And that was a novel change.
In its sort of definition of who students were, it fit into that community notion too.
Yes.
I remember in the first class, well, I don't know about the first class, but within the first couple of classes at Orange County, we had students ranging in age from 17 to 62.
That really was one of the surprises. We had anticipated the usual college age entrant to about post-high school, 18, 19 years of age. And lo and behold, we had women with children. I remember one in Orange County who was the wife of the superintendent of schools in a neighboring town, and she had 4 children, one of whom had polio, and she became interested in nursing as a result of caring for him in his recovery. So there was a wide range, and interestingly, that has continued. You know, it has opened the door to people who would not have thought of going to college, partly because the old nursing school required the students to live in dormitories, nurses' homes, and obviously a woman or man with a family was not going to absent herself or himself for 3 or 4 years from their family. So we said the students should be like every other student. They should, we should be no barriers to age, race, creed, whatever, and they could live wherever they wanted to live.
You can't predict human behavior. You can't predict human responses. So we have to, in education, allow for this, for a more fluid, a less focused environment. When you see students interacting with patients in the environments of care, you see their faces alight, their eyes aglitter, their interest captured, and their motivation goes skyrocketing.
I think anyone who was in the home or out of the hospital had a certain degree of autonomy that was covert rather than overt, because I think that the way they had to follow the doctor's orders and the doctor's rules meant that what was later talked about in the 60s, early 60s, as the doctor-nurse game was being played out. Today, 20 years later, nobody even thinks twice about including the skills of physical assessment, of taking examinations, of doing the kind of things that were commonly done by a very small segment of nurses. No one thinks twice about the fact that a baccalaureate-prepared nurse must be prepared to do all those things. The nurse practitioner has been one of the best examples of how a field can change, how a field can respond with flexibility to the needs of a society. And that's what I think nursing has been so good at for its entire history.